What is LGBT? A lesbian is a woman who is sexually, romantically, or emotionally attracted to other women. The term gay is someone who is sexually, romantically, or emotionally attracted to people of the same gender. This is usually used when describing a male. Bisexual is someone who is sexually, romantically, or emotionally attracted to people of both genders. Transgender is the term to refer to all people who do not identify with their assigned gender at birth. LGBT people are disproportionately affected by cancer risk factors such as higher rates of smoking, higher rates of drinking, obesity, also including evidence of eating disorders such as bulimia among gay men, incidence of mental health problems and suicide. Key issues experienced by LGBT people at the end of life are anticipating discrimination, complexities of religion and LGBT end-of-life care, assumptions about identity and family structure, varied support networks, unsupported grief and bereavement, increased pressure on LGBT carers. Having a patient's sexual orientation on their file makes everything faster and means we don't dance around the subject at the start of a consultation. It's not about stereotyping but bringing things to the forefront, such as signposting specific services. As health professionals, we should view labels as an opportunity to be able to ask more questions, to find out more about the patient, their loved ones, and their needs. Equality denotes that everyone is at the same level. Equity refers to qualities of justness, fairness, and impartiality. As healthcare professionals, we can undertake training for staff on specific concerns or needs of LGBT people at the end of life. Work with national and local charities to help promote the importance of LGBT appropriate services at end of life. Work with local LGBT groups to understand more about end of life care needs.